Good afternoon. I'm going to call the meeting of the Washoe County School District Group Insurance Committee meeting to order for Thursday, May 27th, 2021 at 4:02 p.m. And 1.02 roll call.
Okay. Jeff Bazo.
Present.
Okay.
Present.
Eric Diamond. Okay.
This is Rachel Drake.
Mike Dixon.
He'll be late.
He'll be late. Okay. Rachel Drake is here. Serena LaRue Hatch.
Melina LaRue, definitely here.
Diane Lyon is going to be absent, said. Tony McMillan.
Here.
Tony Moresto.
Here.
Don Miller.
Here.
And Robert Munson here. We have a quorum.
Okay. And if you'll mark others present as they come into the meeting, please.
Absolutely.
1.03 public comment. Comment from the public is invited at this time on topics not specifically addressed elsewhere in the agenda. Veronica, do we have any public comment?
No.
No. Moving on. Discussion, presentations, and action items. 2.01, action to adopt the agenda. Items on this agenda may be taken out of order. The public body may combine two or more agenda items for consideration, and the public body may remove an item from the agenda or delay discussion relating to an item on the agenda at any time. So can I get a motion to adopt?
I'll motion to adopt the agenda.
I'll second.
I have a motion made by Jeff and a second by Tony. All in favor, signify by saying aye.
Aye.
Hi.
Opposed? Motion passes. 2.02, presentation and discussion of the Washoe County School District Group Insurance Claims Experience Report as of May 2021. This is for discussion only, and I'm going to turn it over to Lloyd. Welcome, Lloyd.
Thank you, Dawn. Lloyd Barnes with LP Insurance for the record. So we're going to go over the April claims data. So Veronica, if you go to the next slide, please. On Exhibit 1 here, what we are looking at is, again, the first 4 months of the current plan year. Enrollment's fairly stable, down about 1.5% from an employee perspective. The net paid claims year to date so far, 4.83 million compared to 4.89 million last year, down about 1%, just a little over 1%, with a composite cost of $664.99 versus $662.05. So almost as flat as we can get, which is good. Fixed costs for the current 4 months, 426,000 versus 418 last year, 2% and 2% higher, and that yields a total plan cost of 5.264 million versus 5.317 last year, down about 1%, with a total overall composite cost per employee of 723.67 versus 719.60. So as I said, very, very flat, as we noted, and that trend has sort of been continuing. It's actually come up a bit as we've moved through the first 4 months of the year. From a large claimant standpoint, again, it's still very early in the year, only 3 claims having started to be tracked over the $200,000 level. Go on to the next slide. So again, move my little screen there. So again, looking at the 12-month rolling average revenue and expense. You can see there, we have started to see that uptick in cost. So it started last month. And again, this is a rolling average. So, it smooths out the expenses from the up and downs that we see every month. But it's starting to uptick a little bit, and not anything to get super concerned about, but it is starting to tick up a little bit. Go to the next slide. Okay, so I'm actually going to switch over because I can't see that real well on this screen. Maybe not. Yeah, perfect. That works. If you can arrow down to the bottom section there, Veronica, for us. Go down further. I'm going to go down all the way to the bottom there. Yep, that'd be perfect. Oh. Okay, so in looking at the month of April, you'll see there, and I'm just going to focus on the employee dependent roll up there, which is really on line 30 and 31. You can see there that the total claim expense for the month, the net claim expense was 3.89 million. But it's important to know there that there was on line 22, you can see $622,000 in stop loss reimbursements. And then line 26, you can see there was actually, this is a few components of the pharmacy rebates that got paid out in April, or got adjusted in April. So that resulted in the larger than normal recoveries for the month of April. So April itself was actually a fairly high claims month. Not ridiculously high, but it was a fairly high claims month. But with those recoveries, it obviously took it down to a much more favorable level. So you can see there that the kind of claims composite cost per employee, 535.89. And then as we add in the fixed cost down below, 594.59. If you go over to the far right there, you can see there that as we add in very bottom line 35, all in, the composite cost per employee 723 for the first 4 months versus 1960. So up just slightly for the first 4 months of the year compared to last year. I think we can skip through to the large claims exhibit, sort of as so this, the active and retiree, and then all the plans. We'll let you go through those as needed. We can keep moving through there.
What page do you need, Lloyd?
I'll stop you when you get there. Keep going. Yeah, right there. Yep. Move over a little bit to the left. So you can see there, the claims that we're tracking, as mentioned on the first summary slide. We do have 3 claims that we're starting to track now. Fortunately, nothing real dramatic at this point from a large claim standpoint, but as we know, those tend to ramp up as the plan year moves forward. So actually all 3 of them are about the same, right around 225, 250 in paid amounts so far to date. So going to the next slide should be the IBNR.
That's actually the last one.
Yep, you can go on one more, Veronica.
That's the last one I have.
Oh, that is? Okay.
Yeah.
So there you go. So I'm happy to answer any questions on the April claims report at this point.
All right, any questions for Lloyd regarding the report? I'm not seeing any.
Thank you.
Thank you. but don't go far.
I'm not going far.
2.303, presentation and discussion of the Washoe County School District Health Plan looking forward to 2022 to include a rate recommendation of 0% increase and discussion on possible benefit changes to include taking preventative dental services out of the calendar year maximum. This is for possible action. Back to Lloyd.
Okay, I didn't even put you on mute on that one. So as we discussed last meeting, all indications as we were hoping them to be, we're looking that we were going to be able to feel comfortable recommending a no increase to the plan for 2022. And as we've completed that process now, as we get into the recommending phase of the year, which hopefully we'll be able to leave you with some good news as we go into the Memorial weekend, which is that we are recommending a 0% increase for 2022 based on the relatively static cost structure compared to last year. And while we have seen that uptick in claims, it's not at a point where we feel that we're concerned that it's going to be problematic at this point. Now, obviously, things can change. We never know until we get there. But at this point, where we have to start making the recommendations and you have to start considering what you're going to do for next year, we feel that it is such that we can go forward and confidently recommend a flat increase. That being said, just a couple of caveats and follow-ups from last month's meeting, which is looking at what we see inflationary costs happening, utilization pressures, just sort of building on that conversation for the last couple months. And that is, the industry, I think I mentioned in the last probably couple meetings that their industry still has some concerns about what is going to happen with some of the pent-up demand, pent-up usage, and or people not getting care and then having worse outcomes, worse conditions. Interesting, I read an interesting article a couple weeks ago on that topic, and there seems to be that just does not seem to be materializing yet. There's still some concerns around it, but as we are starting to get back to some semblance of normalcy, we're not seeing that as much. Where we are seeing some things that are a little more concerning, and certainly concerning from my perspective on a local basis, is we're starting to see some contract pressure from providers. And for those of you that are following any of the news coverage or the media coverage with Renown and United Healthcare, they're in a contract battle around higher reimbursement rates for Renown. Where that ends up is somewhat irrelevant for your plan, but I think it's speaking to what we are seeing is some efforts by providers for their reasons to get higher reimbursements for their facilities or for their services. And so I am concerned that probably over the next 1 to 3 years, we are going to start to see some more contract inflation pressure from both hospitals, pharmacies, radiology, all of those various services. So, again, I'm not. Your plan is running well. It's stable. We got some of the favorable outcomes of the Anthem change from last year, which we've talked about. So all in all, we're feeling very comfortable with the recommendation and confident with where your plan is running. But I don't want to lose sight that there is just more uncertainty out in the horizon than we've seen in a long time in our industry, and so I just would leave you with that. As Dawn said, as she read off the agenda item, we were requested to look at the possibility of or the impact of a benefit change to take the dental preventative care services outside of the annual maximum for dental services. We did do that assessment, and the financial impact to the plan is estimated at right around $100,000. And so in conversations with Jackie and the district, we are suggesting that you could go ahead and make that change to the plan. And we do not feel that it would be material enough to change this projection or this estimate cost projection at this point in time. So we're comfortable if you do decide to move forward with that dental benefit change, that we could still stay the course with this 0% increase as well. So I think that's
It looks like Robert has his hand up for a question.
okay. Well, that's a good stopping point. I'll let Robert ask your question.
Thanks, Lloyd. I was just curious with the, you're talking about the inflationary rate, but I'm also thinking about the increased competition. But do you think with the addition of the new hospitals that are being built and facilities that are being built, is that going to just keep up with demand in our area and growth? Or do you think that's going to help reduce costs because there's going to be more competition over time?
I don't know that I can answer that question completely, Robert. I mean, ideally, some more competition would add for some more price competitiveness for providers. You've been around this industry long enough, and you've been in this game, quite a long time, and so you've seen that increased competition doesn't always result in better pricing. And I think one of the challenges we're facing right now is and I don't know if there's anyone from any of the hospital systems on board, so someone might challenge me on this, but there's a lot of positioning going on right now with providers, insurance companies, the healthcare providers, and we're just, given the nature of our local community with Renown and St. Mary's and Northern Nevada, UHS, who owns the new hospital, who also owns Prominence Health Plans, and Renown owns Hometown Health, and there's just a lot of interesting market positioning going on right now. And so I don't know that it's a direct correlation that increased competition will ultimately result in better pricing for us. I'm more concerned that it's going to create more polarization in the networks and in the availability and access to these providers. That's what I'm most concerned about. I think, we've gone through some nice cycles, and you've seen most of them, where we went from almost complete exclusivity in this market, where if you worked with this network or insurance company, you could only go to that hospital. And then we moved to a more balanced, sort of, you can go to any provider type of model over the last few years. That's been a development over the last, 4 or 5 years. It's been moving in that direction. I'm concerned we're going to go back to more exclusivity, and that's one of my concerns. And whenever you have that exclusivity, you might get some more pricing concessions, but you certainly don't have competition pressure. So I don't know. Does that help?
Yeah, thanks, Lloyd. I appreciate it. Just something I was thinking about.
Yeah, no, great question. And I'll tell you in about 5 years.
Lloyd, just to add to what you were saying about, I believe it was United Healthcare and Renown. Today, I just received notification that there's kind of a similar situation right now with Carson Tahoe Hospital and the Hometown Health Network.
That's correct.
So there's some negotiations going on there, and it doesn't sound like they're very close. So
no, it doesn't, and I didn't bring that one up just because yeah, we're just seeing this general theme of hospitals and providers wanting more reimbursement. And so as these contracts come due, I think we're going to see more pressure with that. I mean, I think you all know, and fortunately for our relationship with Anthem went through that little process right before you came on board with them. So assuming a multi-year contract's in place, hopefully we won't have to think about that for a little bit longer. And Anthem won't have to think about that for a little bit longer. But again, contracts renew regularly, so it's going to be something that we're going to have to just keep our eye on.
Yeah, Lloyd, I made a note actually to check with our contracting team, and
Nevada, just to check and see kind of what sort of multi-year deal were we talking about here, just to get some more insight. So I'll certainly share with Jackie to be able to share with everyone as well when I hear back.
Thanks, Kelly.
Yep.
Other questions regarding the 0% increase or the maintenance of dental maintenance,
Preventative care. Yep.
preventative care.
Preventative care outside of the out-of-pocket maximum.
Trying to find it on my computer screen really quick.
Yeah.
Any other questions? Selena?
Yes, so I know we had talked about doing other benefit increases, and I'm just wondering, is this the time we would talk about that, or should we make a motion on this first and then transition to that? I wasn't sure on the order there.
I'm actually going to ask Jackie to help me with that one.
So if the committee wanted us to look at other benefit increases, then we would also be looking at rate increases to be able to support those benefit changes. So if the committee if that's the direction the committee wants to go and possibly raising premiums and wants to look at those benefit changes, we can certainly do that.
Robert?
Yeah, I was just going to ask, I know Jackie kind of explained the dental thing, but it has to do with all of your cleaning. If I understand this correctly, all of your cleanings and everything go towards your maximum 2,000 plan benefit each year right now. So if you go in for 3 cleanings, and then you have to do something where you have a bigger cost, you only have a limited benefit. So what this would do, from my understanding, is all the cleanings and everything would be outside of that $2,000. The $2,000 would be for anything outside of the basic maintenance of cleanings and x-rays and things like that. Is that correct?
That is correct. We have had members who have contacted our office, and unfortunately at the beginning of the year, they may have needed a crown and they've exhausted their $2,000 calendar year max. And so there is nothing left for the cleanings. And if they wanted to have a cleaning, they would have to pay it on their own. And so this would take it outside of that calendar year max. And so they would still have those cleanings available so that they wouldn't have to forego those or pay those on their own.
Thank you for the clarification. So that would be, I guess, the direction we would go. So if we want to talk about any changes to the plan, we would bring those topics up and send them back with Jackie and Lloyd, is my understanding. Then we would come back next month. They would usually, what happens when we are increasing increasing the percentage, we look at what we can move around to make the percentage different. So instead, they'd be giving us a menu of things and telling us what we would have to increase by to put those back into our plan. So my understanding, the 2 options are, and yes, my last question is to go with a 0 with no additions, or to talk about changes to the plan and then come back next month. So with that, Tony McMillan.
If I remember right, the discussion about changes to the plan were all, it was because of the discussion that we started, when might we consider reducing, because we are healthy, we are doing a good job, and that, so there was some questions there on, well, maybe we would modify other parts of the plan, whether it was copay reduction or something of that nature. So to hear, if we want to do that, then we have to look at raising dues. That's not what our discussion was about. Our discussion was about when would we consider possibly lowering dues? And that's when the topic came up, well, maybe we would look at possible, other benefits, not necessarily lowering. So I'm not really what what do we ask Lloyd and everybody to look at? It would probably be those areas, whether it was copay, whether it was something like that. What could we handle? What could we handle without a dues increase? Maybe it's 0 changes. Maybe it's $5 on a copay. I don't know. So I think that's more what that question from Selena was about.
Okay, thank you. Rachel?
I like that we have the option to offer a 0% increase. With what's going on with PERS, I think that is extremely valuable. And if we can pair it with an increase in benefits, that's an amazing spot for us to be in right now. So I do hope that is something that we can continue to look for. With everything being very on hold, with what's going on with the new hospitals, with what's going on with medical care use and everything related to COVID, I'm a little leery of looking at anything that would either end up with an increase or make it more likely we're looking at an increase next year.
Thank you. Eric?
I tend to agree with that statement. I've been here just long enough to understand having a 0 is not common. So being able to keep it at a 0 and also just the flux that is going on within the healthcare industry and healthcare usage overall with the pandemic, being able to offer a 0 and maintaining what we have, I think is something that is pretty rare. So I think holding, and instead of exploring a rate reduction and then having to instantly next year or in the next year and a half instantly increasing to make back any losses, I think it would just serve better to maintain at a 0 and leaving the membership alone essentially as much as possible.
Thank you. Selena?
Yeah, I agree. I would like to, for sure, I think, lock in the 0%. And I like that we can do that with this increased dental benefit for sure. When I look at, for example, our insurance fund net position, right, compared to previous years, it is so much higher. And so I'm surprised, considering our last discussion, that we can't do anything else to increase benefits. Like, I agree with Tony, like even a $5 off on copay or reducing the copay for specialists. Like I would like to lock in the 0, but I would also like us to explore what else we can do, considering how much more we have compared to normal years.
Thank you. Robert?
Hold on. There we go. I think I'm off mute now. Ultimately, we want to keep in that fund. We want to keep, I think it's 3 months or 6 months revenue or something like that. I know there's a formula that we're supposed to be looking at. And if we're looking at the numbers as they've grown over the last 5 years, they really haven't, those were such abnormal years. We were so low that we were increasing our premiums every year because they were so low. We didn't have much in that fund. And so we're finally starting to build it up to a healthy fund. My goal would be to look at doing the 0%, doing the extra benefit. And then a lot of the time, I know in the past, and Lloyd can correct me if I'm wrong, but when we looked at things like orthodontia years ago, we looked at fertility, we've looked at some things with copays. They're going to have to look at some data, bring in some data, and we'll have to look at that. But it's also with the fluctuation right now with everything that's going on. My concern is if we go and do something and then there's a huge fluctuation that we're going to hit a 3, 4, 5% next year increase. And I don't want to necessarily put ourselves in a situation where later on we're doing a big increase. So I would rather go with the 0% this year. Ask that Lloyd and the risk manager, whoever comes on board, brings us some proposals on these things over the course of the year, so that next year we can look at maybe making some bigger changes to the plan. Plus, that'll give us the time to look at where the plan goes over the next 6 to 8 months. We're still early in this process, but I just, that would be my recommendation.
Tony McMillan.
I understand everybody's sentiment, and I don't think we've even looked at it. So I think it is worth at least looking at and having Lloyd report, what are the possibilities and what are the recommendations. And like I said, the recommendation may be, because like everybody said, let's wait till next year, have some time. I think we're making a decision or giving an opinion, and we don't have the information maybe from the experts yet. And I think that's what's missing.
So Tony, we can definitely do that, but with the rate projection coming in at a 0%, any changes you make would require an increase to the premiums. So just so that you know and you understand that. The only reason that this moving the dental out of the out-of-pocket max wouldn't create an increase is because the impact to the fund is so minimal. But all of the other changes that we've looked at year after year, those are significant changes. So you would be talking, 2, 3, maybe 5% rate increases for the members. So that was why we didn't bring it, is because right now the projection is a 0%. So any changes, we would need to look at rate increases. And I wanted to share this with you. This is something that I had received from the Council of Greater City Schools, which the district is a member of, and they have meetings with all of the school districts across the country. And one of the things that they were saying with regards to healthcare is that districts feel that although the actual expenditures for healthcare have been flat or reduced this past year, there is a definite concern that the healthcare expenditures will spike prospectively. This is due to individuals with chronic conditions not getting proper follow-up and treatment during the pandemic, and as such, underlying conditions or conditions which were present but not properly treated over the past several months could develop into severe issues. As such, it is important that districts to consider preserving and rebudgeting any savings in their health care plans for upcoming years, as trend increases and actuarial recommendations are issued recommending increases of 5+% increases. So just wanted to share that with the committee too, that it's not just unique to here, it is across the country that other school districts are having these same discussions as to what to do, because it looks like we're doing really good and we're crossing our fingers that we're doing really good, but with just all of the unknown that's coming ahead, that we just need to keep that in our thought processes as these decisions are made.
Eric?
Yeah, I just wanted to reiterate just a degree of conservativeness on this particular issue. Again, just because of the brief history that I've had here, I've seen how easy it is that we start, adding these percentages back as increases to our membership. And so, like I said, it is an extreme rarity that we've been able to even consider a 0% towards the membership. And though it seems short-sighted, or can appear short-sighted, that we haven't explored other options to increase coverages, I just think it's worth repeating that a degree of conservativeness here is definitely on hand.
Jeff?
Thanks, Don. I'd like to echo the statements about the conservative approach, just because, what Lloyd had told us about, in the next 1 to 3 years seeing probably drastic, or at least, maybe some pretty hefty contract inflation. We want to be prepared for that. And I think it's important to remember that the fund isn't in a good position just because the rates have been high enough. But for 3 consecutive years, we transferred $5 million from the OPEB fund to the health insurance fund for a total of $15 million, just to help stabilize the fund. So, thanks.
Thank you. Kelly.
I was just going to say, we shared this with Lloyd and John as well. And just sort of for context, we pulled the sort of average trends for both medical and pharmacy for Nevada. And the medical trend is just at or above 11%. And RX trend is at 14.3. So that's just some context about what we're actually seeing in the market of the cost of care going up about 11% from a medical perspective. Again, I think the district has done a great job. So I just wanted to give that for some additional context, if that helps.
Thank you.
Sure.
So the chair is from the chair, sorry. As someone who also has sat here for a long time and had to do those awful increases, it was nice to be able to offer 0 for possibly 2 years if we offer it this year. As we talk about that, if you've read the papers, there's a major issue in the South with the school district and their self-funded insurance, and that they've gone in the hole. And we had a very low few years where we struggled and we stressed about being healthy. And now I think they're like 50 million is the last count I read from Clark County. We never want to put ourselves in that. So I agree that it looks healthy and it is healthy. It's on the healthy trend. It's trending healthy. I'm not sure we're still at 6 months. I think and as stewards of that, it's something for us to be aware of. Robert?
Yeah, and I think that the trend's important. When I first came on this committee, it was years ago, and when they did the 5-year, 10-year trend, we had been in the red for quite a few years, and it took a long time for the district to build up this fund so that it was really healthy. And it got really healthy, and then we had Lloyd can probably be better gauge on this than I am, but it was like 4 or 5 years where we had a lot of catastrophic claims that really hit us. And then the prescription drug costs were spiking, and it depleted that fund really quickly. And that's why we had those years where we had to raise premiums. So, it's not a nest egg to sit on and say, wow, look at what we've got. It's a nest egg to say, you know what, if there is a spike or we have a lot of catastrophic claims, which you never know when that's going to happen, we're not raising premiums 10 or 12%. We're raising them 1 or 2% down the road, maybe.
All right, more discussion? Would anybody like to make a recommendation or put a motion onto the floor? Jeff.
Thanks, Dawn. I'll motion to recommend to the Board of Trustees and Superintendent a 0% increase to rates, including taking the preventative dental services out of the calendar year maximum.
Eric Diamond, second.
All right, I have a motion and a second. Any discussion? Okay, seeing none. All in favor, please signify by saying aye.
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 All opposed, signify by saying nay. All right. So the motion to go in front of the school trustees and superintendent is a 0% increase and taking out preventative dental services out of the calendar year maximum. Thank you. I just will say that it's really nice because usually we're still doing this in July. And I can tell you, guaranteed Jackie and her team are super excited because that means they get to start working on documents early and not pushing it off to the last minute. So nice job.
We don't have to have special meetings over the summer. Yay.
Selena.
I just wanted to follow up on Robert's suggestion, though, that maybe they could bring to the committee The cost of reducing copays as well as orthodontia or adding in orthodontia. I know these were two things that we had talked about in the past, and I agree with Robert. I would like to explore that for perhaps next year.
I think Lloyd has heard. So over the next year, we'll discuss those issues and the other ones. I think there were several different ones. So thank you. All righty, moving on. 2.04, presentation and discussion of the Washoe County School District Group Insurance Anthem Claims Activity and Turnaround Report as of May 2021. Welcome, Kelly.
Thank you. This is Kelly Dvorak from Anthem for the record. Thank you, Veronica, for pulling that up. This is the medical report that we're looking at here. Again, this is a live feed, so you do see May claims already trickling in, but I will focus on April. We had a total of 15,616 claims for the month of April. That was the medical. Down at the very bottom there of that first box, we also have the RX claims at 7,353. So I would say RX is pretty well in line. We did see about 1,000 more claims in April than we did in March. So as far as claims timeliness, we had 90% paid in the first 14 days, 97 in the first 30, and then 99.95 in the 60 days, with 100% of all claims paid within the 90 days for total medical there. If you want to tab down just a little bit for the PPO total, again, primarily most of the claims came in on the PPO plan with 14,329 claims. 90%, happened to be paid in the first 14 days, and then 97 in 30 and 99 in 60, with 100% in the 90 days. And the HSA, again, 1,200, just shy of 1,300 claims for the month of April, 92% paid in 14, 98 in 30, and 100% of the claims were all paid in 60 days on that plan. Any questions at all for me on the medical?
Any questions? Seeing none.
Perfect. Then we can go to the dental. Perfect. Thank you. So for dental claims in the month of April, 2,811 claims. We had just shy of 99% paid in the 14 days. And I don't know what happened. Oh, and then 100% paid in 60. It should say 100% there. We didn't have any remaining claims. So all were paid within the 30 days.
Any questions? I think we're good.
Perfect. Thank you all.
Thank you, Kelly. 2.05, presentation and discussion of the Washoe County School District Group Insurance Wellness Program report to cover current events and programs, Step into Paradise Challenge wrap-up, wellness and guidance resource virtual workshops as of May 2021. Discussion only. And Janelle.
Good afternoon, everybody. We have the wellness report here, and the first thing we have the current programs and challenges, and we just finished the virtual workshops, and most of those were ran through Guidance Resources, which again is our EAP vendor, and the all of the attendance, the participant numbers are listed here. And they stayed pretty stable. Our highest was 61, and then our lowest was 29, I believe, or 28. But all of those, even though they're not huge numbers for our population, they are all higher than the virtual workshops we've ran in the past that weren't part of, this structured outline and being incentivized. So we did see an increase overall. One thing I'd like to highlight is that we had 179 members attend either one or more. So I was happy to see that number, and this is not on this report, but we had 53 members attend at least 4 of the workshops. So that was a good number to see as well. And we did have our, of the 53 that attended 4 or more, we did have one winner of the raffle, and they got to choose out of 3 prizes. So they got to choose a gift card of their choice. So that was the virtual workshops went really well. So I think that's something we can look at doing in the future. Second thing is the Step into Paradise. So that was our spring step challenge that we ran, and that wrapped up on April 26th. Just some statistics and results from the challenge. We had 75% of the teams reached the final island destination. So they basically completed the challenge. We had 5 winners that were drawn, and they were drawn from participants who averaged at least 5,000 steps a day. All 5 winners received a $100 Amazon gift card. All of the winners were super happy to receive that news. And then you can see the company results there. It's always fun to see how many steps we had as, you know, everyone that participated. We have our grand total of steps and the miles that we completed. So it's always kind of cool to see that. And again, we had 742 participants that that were in the challenge, and that's compared to spring of 22 or 2020 step challenge, which we only had 693. So increase there as well, which we always like to see. And then moving down, we have the Mindful Minutes. This was the challenge that just wrapped up May 24th. This was the first time we ran a challenge like this. It's a different structure than the step challenge. And the structure is called a Spotlight Challenge, where the participants choose their own personal goal and they work towards that goal and track it over time. So it was a 2-week challenge, first time we've done it. And so we just have some of the stats here. We don't have the final numbers because it wasn't completed yet, but we had 497 members participating in that. And everyone who reached at least 75% of their goal, they'll go into a drawing, and that has not been completed yet. So once that's done, the winner, 3 winners will be drawn, and we will let them know they're the winners. So that will happen very soon, probably within the next week. And then the final thing we have going on, we wanted to offer something for the summer months for those who are continuing on and not on break, but also for those who are on break, just to keep their wellness in mind. So we're doing summertime wellness bingo. There's been some email communication on that. Also, all of the bingo information is living on the wellness website. You can find it there, and you can print off all of the items that you need to participate. This is an off-platform challenge, so Virgin Pulse is not a part of this. Honor system, and like I said, all of the information and the resources needed to participate are on the Washoe County School District Wellness website. And we were at 277 members, but we're up, I think we're closer to 400 or even more people that are signed up for that now. So more communication will continue to go out as we wrap up the school year on that.
Questions for Janelle?
Oh, I'm sorry.
Oh, sorry, go ahead.
I was just going to say, I'm happy to answer any questions that anyone has.
Questions for Janelle?
Eric Diamond, I got a quick statement maybe.
Okay.
Hey, Janelle, big fan of wellness, love it. The Island Step Challenge, that was good. We had several participants in that. For the the seminars, the wellness seminars, that was pretty good. The only critique I might have there is I did have a couple of people that were still working during some of those seminars, and I know some of them were off hours, definitely off hours, and some of them were kind of on. So maybe just if there was some input there, we had several people that were like, well, I'd like to attend them, but they're during my work hours and I can't sit through a session. And then finally, there was on your upcoming for the summer bingo situation, there was a couple of things, and maybe since this is off platform, I might just email you direct on it, but there was a couple of concerns on some of the blackout options that some members are not capable of doing. A simple example was donation of blood being one of them. There were a couple members that stated that they're just ineligible for whatever reasons, so that there might be some alternatives that they can still participate in that. That makes sense.
Sure. Yes. And thank you for the feedback. I appreciate that. And yes, why don't you just send me an email directly? And I think there's definitely something we can offer as an alternative for those folks who aren't able to complete that. So that's something that we would be willing to work with people on. But if you could send me an email so that we can have a plan for that, that'd be great.
Excellent. I'll do that. Thank you.
Oh, and also to speak to the hours for the webinars, I did get feedback from other departments as well on that. The webinars can be viewed after the fact, the guidance resources webinars, but there would be no way to reward the points for that. So that would be the only downfall. So if they simply just wanted the information, they would still be able to do that by using the links provided. But as far as earning the points, that's the only downfall there. Now, that's definitely something we can look at in the future, is just offering some more variety as far as the times go.
Right. No, I appreciate that. And like I said, I did notice that a majority of them were kind of like in that twilight zone where it was kind of late in the afternoon, kind of early evening. And there's no way, of course, that we can always get everyone to everything. But that was pretty much the only critique that I had on there, because there were a bunch of members that were trying to, there was a really good return on points for attendance. And so there were several that were like, well, I'd like to do these, but I just cannot sit through these because I'll be on time. And I actually I ran into that issue once or twice too, where I was kind of finishing the tail end of a shift and kind of listening in and whatnot.
Yes, no, that's something we can definitely adjust in the future, especially since we did get, like I said, for virtual workshops, these were very well attended. So it's something we can definitely look at.
Robert?
Yeah, I just had a question. I know as we're going into summer, usually in the first part of the school year, we do a health fair, and I'm just wondering if you're thinking, now that things are starting to return to normal, we're going back to school, the school board has said in the fall, are we going to do a health fair in the fall?
So I would love to say yes. We are not doing a health fair, but just because when that planning starts going on in January, we start planning for venues and just all of those things that happen for those large events. And we just weren't in a place to move forward. So there will not be a health fair, but I can say that we're working really hard to offer things that wellness offered typically and that we had to not offer in 2020. So even though the health fair is likely a no-go, that doesn't mean that everything's going to go, not be offered this year. So we're definitely working on bringing back as much as we can with where we're at as far as guidelines and everything.
Eric?
I realize that you kind of answered this, but the men's wellness fair or health fair, the first inaugural that we got and then lost last year, is that still at least somewhere on paper that is a possibility in the future?
It's definitely on paper. The women's wellness and men's wellness. We were making some major adjustments to the events pre-COVID. We were looking at making some adjustments anyway, just based off of the data that we had and funding and all that. But everything had to come to a stop. So everything is still on paper, and those are definitely things we will look at moving forward program-wise, but no final plans on any of that yet.
All right, any other questions for Janelle? Well, Janelle, I commend you for figuring this all out during some very trying times and keeping everybody moving when we were kind of homebound for a while and not real social. So great work. Thank you. Thanks for a great year.
Thank you.
Moving on to 2.06, approval of the minutes from the April 22nd, 2021 meeting of the Group Insurance Committee. Hopefully you all had a chance to look over the minutes. Does anybody have any corrections? Seeing none, I'll look for a motion.
This is
Robert?
Rachel Drake. I motion that we approve the minutes from the April meeting.
Thank you, Rachel. Second by Robert, I guess.
I'll second it.
Okay, so we have a motion by Rachel and a second by Robert to approve the minutes. All in favor, please signify by saying aye.
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 Opposed? Motion passes. All right, so we are on to closing items. This one's kind of exciting because we get to finish the year together. So 3.01, announcement of our next meeting, which will be June 24th, 2021 at 4 p.m. at the Washoe County School District Central Administration Office at 425 East 9th Street in the boardroom in Reno. I just want to clarify one thing. Jackie, this will probably be our last meeting for the year, right? Since we passed what we usually need to do in the summer?
Yes.
Okay.
Yeah. It would probably be the last meeting. And if any of the members will not be able to make that, if they could please let Veronica know right away, because if we don't have a quorum, then we wouldn't have that meeting.
Perfect. Tony?
The calendar invites all have Zoom on them. So can Veronica make sure that changes so that I plan accordingly?
Veronica, can you send a new invite for us, please?
Yeah.
Thank you.
Thank you.
All right. So I look forward to seeing you all for the last one time in person. That'll be nice. Moving on to 3.02, public comment. Veronica, do we have any public comment?
No.
No? Okay. Then 3.03, if there's no objection, I'm going to adjourn the meeting at 4:59 p.m. Is there any objection? Then I call this meeting officially adjourned. Have a great weekend, a nice 3-dayer.
We'll see you. Thank you.
Bye.
Bye.